And different variants continue to sweep across the nation. Testing has become more available, and that includes a popular rapid antigen test that you can pick up at your local pharmacy with results in as little as 15 minutes. But there is a problem. Experts say a majority of those at-home tests are going unreported, and that can lead to health officials not recording the correct numbers of positive cases. 7 Action News reporter Peter Maxwell spoke with doctors who say these unreported cases could be a cause for concern. Peter, you're joining us now live. This is a concern.
Well, yeah, and it was just last month that the CDC changed its guidance and it removed the recommendation to report your positive COVID result or your negative COVID result to the health department or to your health care provider just in time for the holidays. At-home COVID tests are leaving health departments in the dark when it comes to the results. The reason? Some people who are taking them simply not reporting their positive or negative results because it is optional. Dr. Muhammad Hemeni is the former chief health strategist for Wayne County's COVID-19 response. He says those taking the at-home test should report the results to their local health department.
It's absolutely very important because, as we know, contact tracing is the key in epidemiology whenever we are trying to find out who got exposed and who is at risk.
While the at-home tests are very helpful and convenient for folks, the test can provide people with quick results within 15 minutes, vaccinated or not. But a positive test can go unreported, and then the contact tracing can't take place. But medical experts say that these at-home tests are still a major key in controlling the virus. Still, even testing positive with the at-home antigen test, they're just screening tools.
Just a word of caution, we certainly want to make sure that if it's positive, then get reported. But however, the accuracy of some of these tests can be misleading.
Doctors still rely on the gold standard of COVID testing, the PCR test, and those are done in a lab. Those labs then record their findings, positive or negative, and then report it to the local health department and eventually makes its way up to the national health agencies. At Henry Ford Hospital in Detroit, Chief Clinical Officer Dr. Mankara says those who do test positive need to contact their primary care provider.
With respect to reporting, they need to check with the health department because I believe that all cases need to be reported to the health department. If they have any specific symptoms or concerns regarding their health and their care, they need to reach out to the primary care physicians.
And we did speak with the Michigan Department of Health and Human Services, who told us that the biggest thing that someone who tests positive can do is change their behavior and contact their local healthcare provider to report that positive case. Reporting in downtown Detroit this morning, I'm Peter Maxwell, 7 Action News.